Okay, let's talk about latching babies deeply. Yes, we're going to have those one-off problems where something strange happened, or baby's in a lot of pain after birth, or they're tongue-tied, things like that. But the majority of breastfeeding problems come because baby isn't latched far onto the breast and mom doesn't realize it. So she either doesn't know how to fix it, or she thinks that it's going okay and it's not. So getting babies to latch deeply, teaching parents how to latch baby deeply onto the breast is huge to get rid of all those reasons why mom might end up stopping breastfeeding before she wanted to, like not having enough milk, baby not transferring enough milk, things like that. So baby latching further onto the breast helps baby get more milk. It helps then mom make more milk because baby's been removing more milk, and it helps mom be more comfortable. So it's going to help with things like bilirubin and urine output and weight and blood sugars and all of those things, simply because the baby is latched further onto the breast. So how do you help a mom latch her baby deeper and help her know if her baby's latched deep enough? Step one is skin to skin. Research shows that the more skin to skin this baby's held, the better he or she will latch. Step two, when mom is breastfeeding, so she's got baby skin to skin for this breastfeeding, is she comfortable, or is she all like hunched over and twisted up in a pretzel and she's leaning to one side? Make sure she's comfortable first. Does she have nice pillow support behind her back, under her arms? The goal is for mom to learn how to assist the baby instead of the staff helping the baby get far onto the breast, because she's going to have to do this in a couple days when she goes home. So try to read the room and see how much or how little help she would like, and then try to be as hands-off as possible. So start by asking her if she has a favorite way of holding the baby. Does she feel more comfortable with a certain arm? Is she right-handed and feels more comfortable holding baby in her right hand? If so, she could feed the baby on her right breast in football position and from her left breast in cross cradle position. Yeah, just different things like that. Does she have a favorite way of holding the baby? See if you can incorporate that into how she breastfeeds the baby. And then observe as she latches or attempts to latch the baby on. Give her some feedback, some praise. What did she do really well? And then what did you see that she could tweak to try to make things better, to make this latch deeper? Consider laid back breastfeeding. This is where mom is reclined. Baby can often latch themselves deeper on their own because gravity is helping them. Babies tend to relax a little bit more in this position. It can be really fruitful, especially if you have a dyad that's just kind of been struggling with latch and things are difficult and they're stressed out. Try laid back breastfeeding. Mom's gonna have a little bit less control in this position, but usually baby makes up for that and more because they have a little more control. Another great one, if baby is really angry or if mom is tired, put them in side lying. So recline the bed all the way flat, lay mom on her side with a pillow under her head and a pillow behind her back to support her back, and then baby can just be on the mattress. And in this case, well, in all the cases, we'll talk about latching, but you're gonna wanna stick baby such that her nose is up against mom's nipple. Again, in this one, mom's gonna have a little bit less control, but that's okay. We'll show her how to make up for that. We talked about encouraging mom maybe to hold baby in her dominant hand if she's really strongly dominant in one hand. Okay, if you are to the point now where you're gonna provide more hands-on help to get this baby latched on deeper, call dad over and have him watch you and teach him how to basically be you when they go home. So one of the biggest adjustments that I make when helping a mom latch a baby deeper is to move the baby towards his feet. Usually the baby's too high and their mouth is at the mom's nipple, in which case their head is kind of down and they can't open very much. Or it's even just straight ahead and they still can't open as much, as if they're in a sniffing position. So if you put their nose at mom's nipple instead of their mouth, now they're coming up at the breast and they can open up a lot wider and latch on a lot deeper. It also works great because say this is mom's nipple and this is the mouth. It's not a symmetrical latch, right? Baby is not latching on to the same amount of breast tissue above the nipple as they are below the nipple. It's an asymmetrical latch. Baby's latching on to a lot more breast tissue by their chin than they are by their nose. So move baby's whole body towards their feet so that they are nipple to nose. And then start from that position. And that's the case no matter what position you have this baby in. If you're in side lying or cross cradle or football or cradle hold, starting nipple to nose. And it's also a really quick thing that mom and dad can think of before they get started to help them latch deeper when no one else is around. You can help position mom's hands onto her breast. She doesn't have to hold her breast or shape her breast, but it certainly can help to get the baby on a lot further. So if she's going to hold her breast, you want her fingers and her thumb to be at baby's nose and chin and not at baby's cheeks. And I always like to tell them, think about it like a sandwich or a hamburger. If you were eating it like this, that would be fine. But what if you turned that hamburger this way and then you tried to take a big bite? It would be very difficult to take a big bite, wouldn't it? So if she's going to shape the breast or even hold it and compress it just a little bit, her fingers and thumb need to land where baby's nose and chin are going to land. And that will adjust a little bit depending on how she's holding baby. And if he's a little more upright or a little more laying on the side. Then she's going to touch her nipple from baby's nose to his mouth, down in that philtrum right here. And wait for that big open mouth. She's going to have to be very patient. I talk a lot about patience and persistence when we are working on latching in a room. So encourage her to have a lot of patience to wait for that big open mouth. If baby gives her a few just small openings, a medium one, like tell her to wait for that one that looks like a yawn. When baby opens very wide, then move the baby quickly towards mom. It's a nice soft place to land. If you go too fast, too hard, it'll be okay. So aim the baby's mouth onto the areola by the baby's chin. So again, we have the nipple, we have the mouth, and the mouth is coming on the areola by their chin, not centered. After the baby's latched on, which this could take multiple attempts, baby might latch on and immediately mom can tell this isn't a good latch and have to try again. Or as she's moving baby close, baby starts to close his mouth and the timing just wasn't great. So many reasons. I tell them it can take 15 tries before you get a latch worth keeping, but it's worth trying again and being patient and persistent because that's how baby's gonna learn how to nurse. And when they're latching on easier and easier and quicker and more on their own, they're gonna latch that way. So if you can teach them to latch with that wide open mouth far onto the breast, it's going to help mom's milk supply and baby's milk transfer and their comfort for the long term. So after baby's on, ask her if it's comfortable. How does it feel? It might feel like a tugging sensation. It shouldn't feel like a biting. If she has a lot of pain already, it could be sore from the previous trauma. But if that's the case, it should still feel better than her previous latches did. So does this latch, is it either comfortable or does it feel better than her previous latches? And if not, then you probably need to come off and try again. Does it look like baby's covering the breast as much as possible? Are the baby's lips turned out like a fish or sucked in? So here it's really hard to find good latch pictures, but here is one example that's okay. The thing I would tweak with this is I wish the chin was a little more touching the breast instead of the nose. But you can see it's hard to get a great picture of a latch because usually they're kind of hidden in the breast tissue. You can see that her lips are turned out. You can see her mouth is open wide. So encourage mom that if she thinks the latch might be shallow, she should relatch the baby. Make sure that she's breaking the seal on the latch before she takes baby off because she could make herself sore just from pulling baby off before the seal is broken. Consistent deep latches will keep breastfeeding comfortable and help baby transfer more milk. She might want to try maintaining her hand position if she's holding the breast and the baby instead of just the baby. She might want to try maintaining her hand position until the baby's actively nursing for 30 seconds and then slowly release the breast, or take that hand and do some gentle breast compressions. Sometimes if they move their hand right away after baby latches, the baby comes off because the breast tissue is moving around in their mouth. Breast compressions can be really handy for helping baby transfer more milk than what they're already doing with their effort, for keeping them awake, for making sure this feeding has kind of a start and an end point for those moms who are really struggling with day 2 constant feedings. And to do this, they can just move their hand a little bit higher onto the breast and do some gentle intermittent compressions. It shouldn't hurt, so they don't want to squeeze too hard that they're hurting themselves. This also helps them listen for swallowing. So if they're going to listen for swallowing, which I always encourage them to practice doing, when they go to listen and they've turned off the TV and all the noise in the room, have them do a compression and listen for swallowing. And then release it and keep doing it. Okay, it will just increase their odds that they'll get to hear a swallow and practice what that sounds like. If mom isn't going to do breast compressions for this feeding, then she can slowly release her hand that's holding the breast and bring it around to support her other arm. And then make sure she has lots of pillows supporting those arms. Basically, she should be able to relax her arms completely without them going anywhere, because she might be in this position for a long time, especially over the next month. And her arms can get really tired and her back can get really sore if she's the one holding all the weight up. So make sure that she has enough pillows under her arm and her hand that she can relax them, but they don't move. They're still supporting baby. That's also a really great and important thing to teach dad, so that he can help her when he's home. Whenever baby comes off the breast, have mom look at her nipple. If her nipple looks like it did before it went into baby's breast, into baby's mouth, that's great. That's what it should look like. It should be nice and symmetrical. I say that not knowing what this mom's nipples look like. Maybe they weren't symmetrical before. So they should look like they did before they went into baby's mouth. If they might look a little longer, but if baby comes off and it looks like a lipstick tube where one side is compressed, and it's sort of at this slant, baby probably wasn't on far enough. If it has a strip down the middle, or sometimes it looks like a little white raised part, baby probably wasn't on far enough. So based on what her nipple looks like after that feeding or after that latch compared with and added to how did it feel and what did it look like when baby was latched on, now she can use those things to decide next time baby's latched on and it looks like this and feels like this, I'm going to keep this latch or I'm going to take it off and try again. Encourage her to feed baby every time he shows feeding cues and to ask for more help when she'd like it. Don't forget to tell her that she's doing a great job. And then don't forget to chart baby's feeding. If you haven't seen the video, Attaching Your Baby at the Breast on globalhealthmedia.org, please go and watch it now. I also encourage you to show it to your patients. Thanks for watching this video on how to help your patients get a deeper latch.